Last week, a 72-year-old patient sat across from me in my clinic, gripping her daughter's hand and crying because she had forgotten her own grandson's birthday. She was convinced her mind was fading forever. But after 30 years in medicine, I knew where to look first. I didn't order an expensive brain scan. I asked to see her handbag. Inside was a small pink pill bottle she bought off a drugstore shelf just to help her sleep. 3 weeks after taking her off that single over-the-counter pill, her memory came flooding back. It was not Alzheimer's. It was not age. It was chemical sabotage. Every day in my practice, I see vibrant seniors labeled with dementia when the real culprit is sitting on their nightstand. Today, after 3 decades of treating thousands of patients, I am exposing 9 common daily medications that silently hijack your memory, counting down to the single most dangerous prescribing mistake I see in modern medicine. Pay close attention to number 3, because it is a wildly popular antidepressant prescribed for everyday anxiety and low mood. Yet it quietly erodes your short-term memory faster than almost any other pill in its class. Before we dive into the list, take a quick second to drop your age and the number of daily pills you take in the comments below. Hearing your stories helps me tailor every video to what matters most to your health. Let us start at number 9. Number 9 is diphenhydramine, widely known as Benadryl. Do not let its low spot on this list fool you, because this is sitting in almost every medicine cabinet across the country. It is the little pink pill people take for allergies, nighttime sleep, or a cold. Because you can buy it off the shelf without a doctor's note, people assume it is gentle. Inside your brain, it does something very different. It belongs to a group of drugs that block acetylcholine, the crucial messenger chemical your brain uses to create new memories and stay alert. As we age, our brains naturally produce less of this memory chemical. When an older adult takes a drug that wipes out what little messenger chemical they have left, the brain's memory filing center virtually shuts down. Over my 30 years of practice, I have watched countless patients suffer years of heavy brain fog simply because of a nightly sleep aid. A major study confirmed that regular use of these brain chemical blockers raises dementia risk by 54%. If you need allergy relief, switch to newer options like loratadine, sold as Claritin, which stay in your bloodstream and cannot easily leak into your brain. Number 8 is proton pump inhibitors, including omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These drugs turn off stomach acid to treat heartburn and reflux. Patients stay on them for years because the moment they stop, the burning comes roaring back. But here is what rarely gets explained at the pharmacy counter. Your stomach actually needs acid to pull essential vitamins out of your food, especially vitamin B12, magnesium, and calcium. Without stomach acid, your B12 levels quietly plunge. And without B12, the protective wiring around your brain cells degrades. Neurons misfire, leading to confusion and memory slips that look identical to early Alzheimer's disease. A study following over 73,000 seniors showed a 44% higher dementia risk in long-term acid blocker users. If you rely on these daily, talk with your doctor about stepping down to gentler stomach calmers like famotidine, sold as Pepcid, or using natural DGL licorice to coat the stomach lining cleanly. Number 7 is prescribed for a private problem many seniors hesitate to discuss. Number 7 is bladder control medications, specifically Oxybutynin. Given for an overactive bladder, it offers real daily relief. But Oxybutynin easily crosses into the brain, parking right where memories are made and blocking that same vital memory chemical, acetylcholine. A major study tracked adults over 65 and found long-term use raised dementia risk by 49%. In my practice, I have seen seniors lose their keys 10 times a day and forget routine appointments while their families assumed it was just old age. It was the bladder prescription all along. You do not have to choose between your bladder and your brain. Newer medications like mirabegron target a completely different physical pathway and leave your brain's memory chemicals completely untouched. Number 6 is statins, like atorvastatin and simvastatin, sold as Lipitor and Zocor. Statins protect the heart by lowering cholesterol, and for many people, they are essential. But cholesterol is not just a heart issue. Your brain is roughly 60% fat, and it relies on cholesterol as a raw building block to insulate every nerve cell. Strong statins that cross easily into brain tissue can leave your brain starved of this essential material. Research shows a 26% higher rate of mild memory impairment in seniors taking high doses long-term. Patients report scary blank spots, like forgetting a familiar driving route or losing words mid-sentence. Never stop a statin on your own because it protects your heart, but ask your doctor about water-soluble statins like pravastatin or rosuvastatin, which stay in your bloodstream and do not easily enter brain tissue. Number 5 is benzodiazepines, including Xanax, Valium, and Ativan. Prescribed for anxiety and sleep, they work by boosting your brain's natural brake pedal to calm an overactive nervous system. At first, they feel like a miracle relief, but over time, long-term use chemically sedates the entire brain. A study following 8,000 seniors linked benzodiazepine use over 3 months to a 51% higher risk of Alzheimer's disease. Mental flexibility drops, learning slows down, and patients describe living in an emotional haze. The most dangerous part is stopping. Quitting a benzodiazepine suddenly can cause severe, dangerous withdrawal symptoms. Never stop abruptly. Work with your doctor to slowly taper off over several months and explore non-sedating options like buspirone or specialized talk therapy. Number 4 is amitriptyline, sold as Elavil. This older antidepressant is widely prescribed today for nerve pain, sleep, and migraine prevention. Because it treats multiple issues, doctors hand it out frequently. But beneath the surface, it is one of the most powerful memory-blocking drugs still on the market. A 10-year study showed a 54% higher dementia risk in adults taking these types of drugs long-term. Small, nightly doses taken for years silently erode memory without any warning light. For nerve pain, ask your doctor about options like duloxetine or gabapentin. For sleep, very low-dose doxepin or melatonin offer far safer pathways for your mind. Number 3 is paroxetine, sold as Paxil. This is the medication I urged you to watch for in the intro. Paxil is a widely prescribed antidepressant used for anxiety and mood. While related mood drugs like sertraline or Zoloft are generally safe for the mind, Paxil is the dangerous exception because it strongly blocks your brain's memory chemical. A major review showed measurable drops in short-term memory and word recall within just 12 months of starting it. The American Geriatric Society officially added Paxil to its Do Not Prescribe list of unsafe drugs for seniors. Transitioning with your doctor to safer mood alternatives like sertraline or escitalopram protects your emotional health without clouding your mental clarity. Number 2 is antipsychotics, including Seroquel, Zyprexa, and Risperdal. In my 30 years of practice, this is one of the most heartbreaking trends I witness. These heavy psychiatric drugs were designed for severe mental illnesses, but today they are frequently prescribed off-label to older adults for simple sleep problems, restlessness, or nighttime confusion. A landmark study revealed that seniors given antipsychotics experienced a 71% faster rate of cognitive decline within a single year. They suppress your brain's mood and motivation chemicals, leaving patients feeling flat and detached. Always ask your prescribing doctor why an antipsychotic was started and whether non-drug routines, better lighting, or addressing hidden physical pain can replace it. Number 1 is taking multiple memory-blocking drugs together. The single greatest driver of drug-induced memory loss isn't just one heavy pill. It is the dangerous piling up of several mild drugs. Taking Benadryl for sleep, Oxybutynin for bladder control, and amitriptyline for pain all at once creates a massive chemical roadblock in your brain. A major study tracking 280,000 seniors found that taking multiple brain-blocking drugs more than doubled their overall risk of dementia. But here is the hopeful truth I want you to hold on to tonight. Memory loss caused by medications is very often reversible. Sit down with your physician or pharmacist for a formal medication review to calculate your total burden and safely step off unnecessary drugs. Look at your medicine cabinet tonight. How many of these 9 medications are sitting on your shelf right now? Drop their names in the comments below and tell me if you noticed sudden brain fog after starting any of them. Your comment could be the exact warning sign another family desperately needs to read today. Take care of your health, protect your mind, and I will see you in the next video.